use the Q&A feature.
Okay, let's get started here. It's a minute after the hour, and welcome. Thank you all for joining us today to hear about a new part of, or an enhanced part of our employee health literacy services, and that's Quizzify to Go. This is a point of service application. And before we get into that, what I'd like to do is just give you an overall picture of what we're trying to accomplish here at Quizzify. What we're doing here is addressing the issue of poor health literacy. And there's a lot of evidence that at least 80% of adults, working age adults in the United States, are health illiterate. And that means they don't understand their plans. They're spending too much of their own money and the plan's money in the medical marketplace. They don't appreciate their benefits. And they often get roped into a lot of unnecessary and potentially harmful tests and procedure, which are very common in our medical marketplace. Now, Quizzify addresses this in the first way, which most of you are familiar with, is through an engaging quiz format. And that's where, as you can see, Al's there in the picture of when he was on Jeopardy. He adds a lot of trivia and trivia and humor to the questions that we present. And we've got doctors at Harvard Medical School reviewing this content. So some of this health literacy information is a bit surprising, but seeing that Harvard stamp on there gives people the confidence to believe it. So that's our core. That's what we call Quizzify Classic. Those are our monthly quizzes. And what Al will be talking today is about the health at the point of service. And there's a couple components to that. One is a strategy to keep ER bills, for the most part, under $1,000. And the other part is for help with when you're at the doctor to address the issue of not walking out of the doctor's office and thinking, oh my goodness, I should have asked that question. So Al, if you could go to the next slide. I just wanted to, this is the classic part of Quizzify, which we are not talking about today, but we wanted to just make people aware that there's components of what we do here. But what we're offering most of our groups of employees are quizzes once a month with 10 questions in them. They take about 10 minutes to complete. We have a 92% overall completion rate, so we're able to hold their attention, and we serve it up in digestible increments. We've got this review by the doctors at Harvard Medical School, and at this point we have 1,800 questions. So a good part of those, about a fifth of them, are benefits related. So if you're working in a next generation plan and you want a quiz that's about a new navigation system or about even reference-based pricing, we've got content there. And we have both high and low literacy questions. So we have lots of specific insights. And we really try to go to actionable health literacy that people can use right away. Now, that's classic Quizzify. Now, Al Lewis is going to take you into Quizzify to Go and show you that product. So take it away, Al.
Thank you, Mark. We feel that we've achieved minimum acceptable amazingness with our release 2.0 of Quizzify to Go. It has two components. It has the ER sticker shock prevent consent that will keep your ER bills down, and it has the doctor visit prep kits for 190 different topics. And as always, there's going to be polling, the chat box in the Q&A, and now, as Mark mentioned, you can raise your hand and say something to the whole group. So we'll start with polling. The first question is, what percent of your ER bills have allowed costs, including the doctor fees, under $1,000? And while you're polling on that one, Mark, do we already have anything coming in?
Here's something. ER costs for our organization are not a real big spend. Most of the ER bills are less than $800 per year. Would this strategy apply to us as well?
Yeah, ER really only is about $800 a year all in, but the difference between this and many other things, most other things, is that you can cut it by a large percentage. So that's one difference. And the other difference is that this same technique that we're going to show you applies to emergency admissions. as well as emergency visits. We don't get the same percentage reduction, but we do get a good dollar reduction. So overall, you're looking at probably more potential savings here than just about anything you can do that doesn't affect the benefits design. Mark, do we have an answer here?
We do.
Okay, yes, there's a shocker. It's under 20%. I wonder about the folks who are over 60. They probably are in Maryland. And the reason I say probably in Maryland is that, get out of here, is that Maryland has the lowest ER rates in the country by far. The actual paid allowed ER is 600. It's probably up a little bit since then, but $623. Why is that? Well, Maryland is a single payer state. That means that commercial, Medicaid, and Medicare are paying a figure that's basically a weighted average of what they would have paid separately. So Medicare and Medicaid, the hospital gets paid more, so they're not so annoyed about seeing those patients. And commercial, they get paid much less. And the reason we put this up is to show what the potential is from Quizzify. Now, we're not going to get you all the way to Maryland much of the time because the Maryland number is about 150% of Medicare. Our number is going to be 200% of Medicare, but 200% of Medicare is still going to be a 3-digit figure. So we'll show you this consent now. In release 1 already had this features that will show you the pop-up geofencing, the 24/7 support, the rebilling, and now to reach the level of minimum acceptable amazingness, we've added explainer video, an ER quiz, and laminated cards. Why we added those things? Well, the reason we've added them is that the consent only works if you know about it, and we want to make sure that everybody knows about it. So this is what it looks like. And I'm going to blow up my screen here so you can see it. Normally you would see it on your phone, but since this is a webinar, we're doing it on the big screen. When you open your phone to Quizzify to go, you hit that Q, you get go to consent, you get the explainer video, which is essentially what I'm about to show you. And you get this rather extensive ER billing quiz to take. So you become an expert on ER bills while you are waiting to be seen. So let's go to the consent. Avoid large medical bills, write this in. Now, these are 29 of the most cost-effective words you will ever see. Superseding other consents, meaning that if somebody accidentally signs both, we're claiming, and this has never been tested in court, that ours wins. I consent to responsibility, including insurance for up to 2 times Medicare, following receipt of an itemized bill for appropriate care coded at the correct level. Now, appropriate treatment. Now, these are important words because it keeps the hospital from challenging it, because they know full well some of what they do is not appropriate, and they certainly know that they upcode. But the key phrase here is up to 2 times Medicare, okay? Because Medicare, for whatever its other controversial issues, is really, really good at getting a good price in the ER. And even when you multiply it by 2, as you saw in Maryland, when they multiply it by 1.5, you still get a 3-figure deal most of the time. If there's no procedure involved and no major scan, you'll get a 3-figure deal. How you use this consent? Well, you ask the provider to print out the consent form instead of just automatically signing it on that pad. You cross out the financial consent and you write in the 29 words. Remember, you're going to have those. You're going to have those words. I think I have this on the slide. You're going to have those words right on a card if you want. We have laminated cards that have those words on them. Oops.
Yeah, and the cards also have the QR code that leads right to the explainer video too. So if you've got a member or an employee who's not paying attention, if they have the card in their wallet, they'll be able to get to the prevent consent and get an understanding of it.
So then you cross out the financial consent and you write in those 29 words. You take a picture. And the reason that's important is we actually had a situation where somebody did the whole thing correctly, but they didn't take a picture. And then that they got a bill for $4,500 that should have been $1,500, once again, in network. And they said to the hospital, I didn't agree to that. Send me back my consent. The hospital sent them back their consent, but they had whited out the actual written in stuff. The good news, that's the bad news. The good news is they did such a lousy job whiting it out that you could actually still see some of the little curves on the letters. So I said, look, this is fraud. You can get it, you can pay zero. And the person says, no, I don't want to rock the boat. I'll just do the 1,500. But that's why you need the picture. The hospital then, according to federal law that I'm happy to explain offline, has to treat you the same as if you signed their consent. They cannot vary their treatment according to what level you have agreed to pay on. Speaking of you have agreed to pay them. Speaking of agreed to pay them, if they disagree, we have a 24/7 number that they can call to have somebody explain this federal law to them. People at this number make the Maytag repairman look busy. The hospitals know full well that they have to take this consent. When you leave, remind them that you should be billed this way, because if you don't, you could possibly get the wrong bill. When the bill comes in, treat it like any other healthcare bill, but if it's over 1,000 and you think it should be under, just give us a call and we'll either say, yeah, you had a procedure, it's 1,500, it's the right number, or whoa, and then we will take care of it. The very cool thing about this, besides everything else to get you to minimum level amazingness, is that this will pop up, just like when you go to the airport and your boarding pass pops up. This will pop up on your phone when you get very near to an emergency room. Now, how do I know this works? Well, I know this works, number one, because it works, but number two, because where I live, there's a bike path that for some reason goes within about 50 or 100 feet of an emergency room. And when I'm on that path, I can hear my little phone pinging.
So we have a comment here from someone who raised their hand. Can I?
Oh, okay, a hand raise. Very cool.
First, this is Crystal Kent.
Crystal Kent. Okay, we've been doing webinars for 3 years. You're the first person to go live.
Hi, Al. How are you?
Crystal Kent, nice to hear you.
Yeah, so I just wanted to share that I actually did use this ER sticker prevent consent. I think it was maybe about 2 years ago, I had slipped on some ice, hit the back of my head. I had passed out and was taken by ambulance to the ER. And while I was there, of course, I'm not excited that that happened to me, but I was so excited to actually remember this prevent consent. And I think I had even emailed you, Al, that I was like, I was excited to not get the concussion, but very excited that I remembered this. I have to say too, that I'm really excited to see too, that you guys are making this available to keep in your wallet, because at the time when it happened, I had my cell phone with me, but I think I had about 2% left. And so I was sort of panicking that I have to remember to write this down. And so they had come over to me. I was, still in the, the bed, and they came over to have me sign the papers. And, it's really just kind of initial here, sign here. And I asked her to print it out. And I was very nervous, but knowing this and attending a lot of your webinars really kind of gave me that courage to say, okay, Al taught me like what my rights are and, what I can ask for, and, they're not going to tell me no. And so that was very empowerment to be able to have that. So they printed out, no problem. And then I filled out that section. I took a picture of it, very excited. I remembered that, and then gave it to them. The only bill I actually ever got was the ambulance bill. I don't know why, but I had handled the benefits at the time, and I actually never received a bill. Again, I have no idea why. I'm not going to argue with it, but it just, I felt like that writing that did something. I don't know what, but I'm happy with the outcome.
Well, thank you very much for coming on. I will tell you exactly what happened, because it's happened more than once, is that when you get outside of the flow, their automatic billing flow, sometimes people just forget because they're so unaccustomed to it. So you were the beneficiary of that. So thanks for sharing your story firsthand.
Well, thank you. I appreciate what you guys are doing here. This is great.
And we've got another person here, Al, who's raised their hand, Brad.
Okay.
Hey, Brad, you're live. Brad, are you with us?
All right, Brad, we'll come back to you.
Now, in the
All right.
meantime, Al, somebody asked the question, Linda McKean said, is this only for an ER visit, right? What about urgent care?
All right. So the federal law specifically applies to emergency deliveries, emergency visits, and emergency admissions. And that's a lot of emergencies. You can try to use it in urgent care. And people have reported to us, I use this everywhere and nobody objects, but we certainly do not promise that it will work. We cross our fingers and hope that it will work. ER, emergency admissions, we promise it will work. All righty.
Al, John Robeson is also here.
Okay, actually, let's do, John, we'll do the next polling question. Well, because I didn't know the open mic was going to be so popular here, but let's just do this, and then we'll get to John and Brad. So these are the results that we get. This is why we call it minimal acceptable amazingness. This is a bill 99285, which those of you who know your ER codes know this is like the highest ER code you can have, multiple consults and life-threatening and all that stuff. $683 using the consent. Now, these particular folks got a cash discount of $204. You might say, why is the cash discount so great? The answer is it was applied to the in-network commercial rate, not to the Quizzify rate. So that's why it should have been it was like 4 or 5%. It says this bill would have been $4,000 or $5,000. So they ended up paying $478. John, anybody want to come on now?
Okay, John, you should be live.
How about now?
Oh, great. Okay.
Can you hear me now? Sorry, I was muted.
Yeah.
We
Hi,
can
Al.
hear-
Yeah, this is great. And I was just curious about how your Quizzify trivia questions, which I'm very familiar with, fit in with the Quizzify to Go app.
That's a great question. They fit in several ways. One is on the home page where people see the quizzes, they have the opportunity to also download the app. And we're kind of doing that in bright lights because the app only works if you download it. Number two, we have sets of questions that we ask on Quizzify to Go that lead you to the app. Number three, in the app, as we'll see when we actually show the doctor visit prep kits, oftentimes they have a topic-specific quiz that goes with them. So it's a peanut butter and chocolate. Not that we're recommending too much chocolate. It's a peanut butter and chocolate combination.
And we
Thanks.
have another question here, Al. Is anyone using an incentive to get employees to do this? If they have
Yes.
a $100 copay, they may not feel the need to be concerned with the costs.
Yes, a lot of times we hear, well, the employees don't care because it's our money. Sometimes we hear the opposite. We don't care because it's a high deductible plan. So, they both can't be right. But let's say you have a low deductible plan. The way you get employees interested in this, you can't really be messing with the benefits design. That's hard to do, and you can only do it annually. You have an incentive program that right now, you're giving people money to, go get screened or whatnot. If somebody uses the consent, give them 100 points. Okay. Remember, it's your money. You want to align the interests, even if people have a low deductible. If they have a low deductible if they have a high deductible plan and they're over their deductible, they're saving money anyway. They may not be aware of it because they're only on the hook for 20% or something. But one way or the other, you can absolutely use the incentive plan to get otherwise disengaged employees to engage in saving you money.
And Al, another question from Linda McKean. How do we know if they use the consent to reward them?
Well, it's you look at the size of the bill, pretty much. You look at the size of the bill and the code here, and if it's if it ends in 4, 3, 4, or 5, and it's $1,500 or less, the chances are overwhelming they use the consent. Other ways of doing it are that we have this.
Picture.
I'm sorry.
You could request the picture.
You can request a picture. I mean, there are any number of ways of doing it. It's actually pretty easy. And in fact, if somebody did use the consent and you don't give them the the incentive. They'll probably say, hey, I want my incentive, and then you give them the incentive. But we haven't had any issues with people kind of not getting the incentives they should be getting. The chat box is filling up, the Q&A is filling up. We don't have many slides, but I want to make sure I do a few. And then when the polling comes in, we can do some more. So this was one of our greatest hits here. All in network, by the way, so the No Surprises Act does not apply. $12,000 of an in-network charge in an ER that we sent to these folks who do our rebilling. They were the ones we subcontract for rebilling. They found that if you use 2 times Medicare, that most of these charges were either way, way too high or not allowed. The fee ended up being $674 and change. And this is the note from the hospital saying that was payment in full. This was a 95.3% reduction. Needless to say, we are not promising that. So let's look at the states where the stakes are the highest. We showed Maryland, where frankly we can't do anything to reduce the cost. But let's look at the top 6. So Texas. Now, Texas is really 2 markets. It's Dallas and Houston, which are very overpriced, and the rest of the state, which is actually fairly reasonable. If Dallas and Houston were its own state, Texas would be number 1, I think. Nevada, frankly, I don't really know anything about. We don't really do any business there. Colorado, woo! Don't get me started on Colorado. Freestanding ERs masquerading as urgent care centers, dominant hospital systems, high bills. California is only number 3 because of Kaiser. If Kaiser weren't there, it might also be number 1 because Kaiser brings the average way down. Some very predatory health systems that have gotten in trouble with the government for overcharging. And then there's New Jersey. There's hospitals in New Jersey should be competitive with each other because it's the most densely populated state, and the payers should be able to get a really good deal. And yet they don't. So now we'll open the chat box. So who do you think is number 1? And while you're doing that, Mark, I know we have a ton of things
We have
lined up.
we have some guesses coming in here. Somebody just guessed New York.
Okay, New York, if New York City were its own state, they would be number 1. No question about that. Upstate is actually quite reasonable.
And another question here, I think you might have addressed this. Does this prevent consent work with freestanding ERs?
Yes, it does, provided that the freestanding ER is part of a system that has a hospital license. There are not many, but there are some freestanding ERs that are just plain old owned by private equity firms and don't have a hospital license, so the federal law does not apply. There are state laws that apply, but honestly, the state law, like in Texas, is kind of toothless. So I'm not going to hold this up as working in every single freestanding ER. Any other states?
Some other guesses, Indiana, Utah, Alaska, Illinois.
Again, Alaska is a great guess because they're high in everything. They're not particularly high in this. Illinois, once again, if Greater Chicago were its own market, they would be way up there. And as it stands right now, they're in the middle. But some kind of from Peoria north to the Wisconsin line is pretty expensive.
Mm-hmm. Now, there are 2 people that have guessed the correct answer, both Roger Patisi, if I'm saying that right, and Stephanie Z.
All right, Stephanie Z and Roger Patisi, congratulations. The answer is Florida. Florida is basically number 1 in everything that has to do with overpriced healthcare. I mean, going as you can see from the little thing, we are shocked to learn that Florida is number 1. And to keep the Casablanca analogy going to Florida for the healthcare is like going to Casablanca for the waters. Now, you see this with your own eyes. You've heard it. You've seen the bills. You've heard testimonial, and yet some people simply refuse to believe this. We've had people who say, you know, yeah, no, I don't believe it. There's not a question. It's like the scene in The Endless Summer where they're going to go to Tahiti and everybody says, you can't surf in Tahiti. There's no surf in Tahiti. So they go to Tahiti and they surf. And when they're out of the water, some local says, you can't do that. There's no surf in Tahiti. Okay, so that's how well it works. And once again, you don't have to take our word for it, my word, believe your own eyes. These are 7 of the, 10 most influential people in the healthcare industry. You can ask any one of them, And don't say, what do you think of Quizzify? Ask an open-ended question. How do you keep emergency room and emergency admission costs down? And just see what they say. And I don't even have to put names on these folks, so everybody should recognize them. So that's the sticker shock prevent consent. Let's go to the doctor visit prep kits. And once again, we have the open mic, which has been more popular than I've expected. So we're a tiny bit behind schedule here. So let's look at these prep kits. The prep kits actually go from minimum acceptable amazingness to even more amazingness at this point. So before we get into them, you have for complex cases that are seriously in the healthcare system, you probably have a navigator, point solution, some combination to support employees. So the polling question is, for what % of total doctor visits do your navigator or point solutions support employees? And while you're answering, Mark, I know we've got like 25,000 questions lined up here.
There is a question here about using the ER prevent consent. Once employees have reached their deductible, employees may not care about going to the ER. And what can be done about that?
Oh, that's when you use your incentive system. So anytime somebody uses a consent, whether or not they've reached their deductible, they get 100 points or something like that. And that's the only way you can align the incentives. Because remember, it's your money and you want to make them as aligned with you as possible. Mark, do we have some answers on this?
Yeah.
Okay. Oh, yes. No, that's not surprising because you're only navigating the more complex cases, which is appropriate, which is completely appropriate. Quantum, all those companies are very good at that stuff. But now, instead of 20% under 20 or 20 to 40, you can add the others. You have probably a little less than this actually, but close to 4,000 visits to the doctor per 1,000 people. So now you can navigate everything. The ER visits, the navigation system, the point solutions, and now everything else with the doctor visit prep kits. We already had 180 topics. It's now 190. We already had calendaring. And now we have we already had topic relevant quizzes in some cases to answer the question that was asked on the chat. But now to reach even more amazingness, we have a lot of other features. But before we get to other features, I do want to focus on a couple other things. One is that we've added ways that you can get to information about possible prescriptions, just the way some folks have ratings of doctors. There's a site, drugs.com, that has user reviews and ratings for prescriptions, and they have lots of data points on most prescriptions. And if you come up with topics that we haven't thought of in this doctor visit prep kit, we will give you $25 if we use that. We'll see the rules. The rule to collect the gift card is that you have to propose a complaint or a diagnosis that we don't already have, and that when you Google on it, it shows up as very common, because we want to hit the 80-20 rule of reasons to go to the doctor. Frankly, we thought we'd already hit it, but then people have suggested other topics that we look at and we say, oh my goodness, we absolutely have to put this in. And that's what we want you to do, and we'll pay you for it. Now, before we actually get to the site, I just want to ask a question generally. When a patient, not generally, this one actually has a specific answer. When a patient asks a doctor for a drug they saw advertised, what % of the time will they get it? And while you're guesstimating that, Mark, I'm seeing that everything light up here. What do you got for us?
Well, if we're encouraging people to ask a fair amount of questions and be prepared for a visit, how do doctors react to this? Do doctors get upset by all these questions?
Well, I would say that I wouldn't say it. You can ask the experts. If doctors get upset by patients asking appropriate questions, you got to find yourself another doctor.
That's right.
So do we have an answer on this one? Okay, actually, something that this audience is even more cynical than the actual answer, which is 55%. But that's still, when you think about how expensive these advertised drugs are, that's a mind-blowing figure. And if you go to the, remember, we're going to send you the slides. If you go to this site, you'll see that 2/3 of these drugs that are of the 81 most heavily advertised drugs don't actually add any value. And it also depends greatly on the patient. So you see these things advertised on TV, you know, like Humira is very expensive. And yet, as the rumor mill is correct on this, it does not work. Even, you know, these things are done by diagnosis, matching the drug to the diagnosis. It does not work for a large chunk of people. And it's an expensive drug that you're paying for. Now, Mirvaso, I had never heard of it. I looked into it because the reviews were so bad, and they were getting so many reviews. This tends to be advertised to dermatologists for rosacea. And as you can see, it just really doesn't work. It's $640 for a tube. You can get a $160 generic of something else that has much higher ratings. So should you counter detail against heavily advertised drugs, just the way health plans will sometimes counter detail in doctors against drugs that are heavily advertised to them. That's what this part is for. So now let's go visit it. We've looked at the reviews, we've looked at the rules. Let's look at the actual prep kits. So once again, explainer video. It doesn't really fit with a quiz, so we have FAQs here. Then we have a little explanation. You know, do you ever leave? I mean, who amongst us does not occasionally go to the doctor and forget a question, miss an instruction, or want more information, et cetera? So let's go to the prep kits. And like I say, we've got 190 of these things. And all you have to do is enter a search term. And we have everything we say from acne to zoster. It actually starts with abdominal pain. That just doesn't roll off your tongue. So you just put a word in here. And we will take word examples, but I'll just show you one first. You put in back. There are different kinds of back pain. You got first visit, second surgical opinion, some generic stuff. Middle back pain is often different from low, and upper can be different from middle. So let's just go with low back pain, and you get a kit, and you open it up, and this is what you get. So the first thing you see is the overview. And remember, we're not giving medical advice. We're not doctors. We don't even play doctors on TV. Frankly, I don't even watch a lot of doctor shows on TV. But we always want to make sure that people don't, you know, that if something serious is wrong, that they get care. And this is this situation. So we start with, if you have fever, headache, rapid weight loss, numbness, weakness, or you can't hold your pee, seek medical care right away. Could be meningitis, could be something else, but whatever it is way beyond our pay grade. Otherwise, and this is a classic Quizzifyism, 80% of back pain will go away on its own, but 80% of back pain sufferers are convinced at some point that they are in the other 20%. A link to Mayo here that says the same thing, albeit not as eloquently as Quizzify says it. So then we have preparing for the visit. Now, if it's a medical issue, the preparation is generally to collect all the drugs that you're taking, note what the triggers are, when did it come on, what relieves it, all the stuff you're going to get asked. In this particular case, because we're betting that the back pain is going to go away, we tell you what to do in the interim. Don't baby your back with bed rest. Bed rest is so 2010. Simple exercises, not sit-ups, should help. And this is a example of the exercises. And remember, these prep kits are largely for employees of our clients, and our clients tend to be large enough that they have other apps. So it says check with your employer. They may have Kaya or Sword or Hinge for exactly this situation. Then there are the questions to ask the doctor. And here there's a little bit of a hidden agenda, which is you don't want to get basically turfed to an orthopedist or sent right away for an MRI. And Mark, I think you had personal experience with that in New York, right?
Oh, yeah. Yeah, right away. The hospital systems bought up a lot of the doctor practices, mine in particular. And as soon as you go in there, right away, you're going for an MRI, even if it's just mild back pain.
Now, the MRI, and we have this in our back pain quiz, it says take the quiz below, and there's a back pain quiz here that you can play. And to the point of, I believe it was John, on the hand raise, the back pain, this is a way that the classic Quizzify and the Quizzify to go interact. So we have the questions to ask, and if we do click on MRI here, you'll see that there is somebody did a control, it wasn't a control study, it was a sort of a mystery shopping thing where they sent the same person to 10 different MRI centers and came back with 49 40, they don't call them diagnoses, 49 different findings, which are the basis for the diagnosis. Note that even though there's a set of questions here, you can add your own question. Your navigator can add it, your coach can add it, you can add it, and then by the time you get them all added, you can put them right in your calendar down here or put them in your Apple Wallet and you'll have them all available. So we've basically facilitated the care navigation, care coaching process by not having to go over the same things all the time and doing things that are very specific to you. So if you have low back pain and you have some comorbidities, that's where your navigator, coach, whoever will put in other questions. Then there's the classic sort of what the doctor is going to do or say. I'm sorry, ask or say, so you can prepare for that. And there's a lot of overlap between these and these. In a really good visit, you won't end up having to ask most of these because the doctor will come up with them on their own. But you just want to make sure these get answered. So these are classic questions from the doctor. And then what the doctor may do, test, or prescribe. There's what we call rule out, meaning make sure that you don't have these things at the top, fever, headache, et cetera, that would cause a medical emergency. And after that, there's a pretty standard set of questions for back pain. There's also a fairly standard physical exam that gets done. And then you should be offered a set of exercises. Really for the first time you have back pain, you shouldn't, they shouldn't really be pushing you into the system like Mark just described, and stay away from the sit-ups. If you want more information, we've curated the best sources for each of these things. The best sources are different. Sometimes they're sources you wouldn't have thought of, like the Alberta Department of Health turns out to be very good at this stuff. You put it in your calendar, you put it in your Apple Wallet, etc. So there you have it for 1 out of 190 different things.
Now we're getting a question here about, is this part of Quizzify? Does this include, is Quizzify to go and Quizzify Classic all together? And what does it cost approximately?
Well, it depends on the size of your organization. You can get them all together. Most people do. You can get Quizzify to go separately. If you're getting them all together and you have, say, 1,000 people and you pay in advance, it's $12 for the year, 12 for the year to do all of this. So
per employee.
Per employee, yeah. So in the immortal words of what was that mustard? I can't remember the Great Poupon. The finer things in life, happily some are affordable. So any other questions? I'm going to go back to the actual slides. Mark, anything else? Actually, let's.
I don't think you addressed this. What if people are a little embarrassed in front of the doctor, intimidated?
Oh, that's a good question. So let's go to the prep kit because we actually addressed that right there. It says, P.S. If you're reluctant to ask, blame us. Now, one of the things, since you mentioned that, one of the other things is that some of these consumer sites will tell you that when the doctor comes into your office, to your exam room, you should ask if they've read the history. And we kind of feel that's kind of confrontational because they haven't, they have those little slots outside the doors of the exam room, and the person who preps you, PA or nurse, taking notes, putting them in, the doctor's lifting them out, it's going to look at them briefly and then come into the room. And if you ask that question, although it's a medically appropriate question, in terms of relationship, we don't think that gets you off on the right foot. You have plenty of other times to ask the doctor questions, and that's just a little bit too much for us. It's your choice, obviously. That's just our recommendation. All righty, so we're actually, this worked out very well for timing. So one of the questions we often get asked is, what are the differences between Quizzify's $12. And by the way, if you're considerably smaller than 1,000, it's going to be more than this. And if you're considerably larger, it's going to be less. Between the $12 PEPY versus and getting the consent and the prep kits and quizzes versus going to one of these sites. Now, these sites generally have very good information, but they're not set up in a way that is mirrors the doctor visit. We are set up to shadow the appointment from what you prepare to the prescriptions from the viewpoint of the patient or consumer. And there's kind of a, whether you're a patient or consumer depends on what you're going in for. You know, like we have, atrial fibrillation, right? So if you're in there because your heart is fluttering and you write in the words heart flutter and you get AFib and you go to the doctor, and the doctor gives you a prescription, I'm a patient at that point. I'm not a consumer. If I'm going in because I have erectile dysfunction, I'm a consumer. You know, I have a sense of what drug I want, and maybe the doctor's going to tell me it's contraindicated because I'm on nitrites or something, but you're on the spectrum. One way or the other, you shadow the appointment. You can add your own questions. You can't add your own questions here. This is designed to be calendared and put in your wallet. We have the quizzes. They don't have the quizzes. We get information from users. So for instance, I flashed that plantar fasciitis thing up a little while ago. The plantar fasciitis prep kit was heavily influenced by users. We learned, for example, that you can get it's called a night splint that you put on your foot at night. And then when you wake up in the morning, you don't get that immediate heel pain because the night splint keeps your tendon from tightening up. That's not in these. That's a user experience. And we've got a lot of those. That's just one of the more dramatic ones. Sometimes we're challenging the conventional wisdom, and that would be a good example. Another example would be, crabs, pubic lice. The medical websites want you to put some kind of insecticide on these things. We've done the research, and it turns out that shaving interrupts the cycle of the pubic lice without any medication possible side effects. It also lets you learn about the drugs you are prescribed using these user ratings and reviews. And we also, these are just 4, and sometimes they're not as good as others, and sometimes others are better. We're curating the best sources for you. So it's worth paying $1 an employee a month to get this kind of thing way beyond what people can learn on their own. And we're also, by the way, pinging them with little reminders that they have this. Mark, we have a couple minutes, and incredibly, we've got
Brad Reedman, if you're still there, you never got a chance to ask your question. I think the mic is open for you if you're there. Looks like he is, but there is a question here. It said, I think you touched on this a bit, but to access everything, are there 2 separate apps that people need to download? I can answer that. The classic Quizzify are the quizzes that we deliver to the group once a month, and we can do that in a whole variety of ways. We can do it by email. We can embed it in a website. The Quizzify 2 Go is one app with 2 parts. The ER, prevent consent, the strategy to reduce ER billing, and also the doctor prep kits. You can once you're in the app, you can toggle back and forth between the 2. So it's only one app to download from the App Store, and then we deliver the quizzes in whatever way is appropriate for a particular employer. Now, go ahead, Al.
I was just going to say, we're just about out of time. I think we'll have to answer these other dozens of questions offline.
We did get a lot of people giving us categories for Quizzify to go out. And so we'll just make record of them and see, there might be 1 or 2 here that we don't have. Most of them look like we have, but for that gift card that Al offered out, we'll make record of what the group here is suggesting. And as appropriate, we'll get back to you if you come up with a new category for us to use. And I'd just like to remind the group here that please set up a demo. We'll show you the whole product, how it might work for a group. and we'll get you on a test version of Quizzify to go that you can play around with as well.
All right, well, thank you. That was great. This, I think, was our best attended and certainly the one that has the most. I mean, there's so much that we're going to have to follow up on here. Q&A, the open mic thing even worked. Thank you for everyone who participated in open mic. So this is great. Thanks very much, everybody.
Thank you.
Oh, John is still on. Brad is still on. Brad, we never got to your question. You're muted. Hey, John.
I was just going to say, I just put in the Q&A what I always say to you. I have no idea why every single organization doesn't do this. It just doesn't make any sense to me, especially with this edition. Incredible stuff, guys. Thank you.
Quite welcome, John.
Okay. All right, I'm considered down here. I got record of everything.
Okay. Yeah, I think you're going to keep me busy this afternoon. That was great. That was great. And I know you like it when it's sort of like joint.
Yeah, there's still some people on here. Let me just shut this
Well,
down.
just tell them how great it was. It was great, folks.
Well, as Peter's on here. All right, I'm gonna let's
Well, I think actually, if it's just the three of us, I think everyone, and I don't, if
now
anyone
we've got a
else.
whole group on here. Let me reach out to you. We'll end the webinar.
Okay.